That taught me a really important lesson. The first time that happened, when somebody called from Wisconsin and said, "I've gone deaf, you're my doctor, what do I do?" There was a sudden fear of what to do. At the NIH, I learned that whenever I felt fear about a subject or a situation, that almost certainly there was opportunity there, because I didn't know what to do and no one knew what to do. And so understanding of that feeling, not to run from it, but to go towards it. That's how I got into HIV research. I grew up in a small town on the Tennessee-Mississippi border called Collierville, Tennessee. There's a population of 2,000. During my very early childhood, I was always curious and wanted to do experimenting. I was allowed at age 4, 5, and 6 to go into the pantry and had an area that I could mix food coloring and flour and whatever was in there and see what happened. Well, I went to the University of Tennessee primarily because of finances. That was the only school that we could afford. The head of the Department of Zoology, Dr. Samuel Tipton, one day he called me in his office and he said, "You really should go to medical school. Baylor is down in Houston, Texas, is a great place." Again, because of lack of money, I had to have several jobs, so I was the night operator of the clinical labs at MD Anderson Hospital across the street from Baylor. We did every test, plus drew all the bloods. And so that's one of the places where I began really to learn to be a doctor. I went to Duke for 2 years for my residency. I didn't rank Duke very highly, but when I got to Duke, I realized that Duke was probably going to be the very best place for me because of the amount of amazing hands-on teaching. And I got to interact on a daily basis with some of the greatest clinical physicians in the country. Well, what Duke did for me is that basically they gave me the clinical experience in that 5 out of 7 call schedule, to where by the time I left Duke after 2 years, I could stand down in the front of Duke Hospital and know that anybody who came with a problem, I could take care of it. And seeing the effect on people's lives of the research that people were doing, I think I first got imprinted on studying the human immune system there at the NIH. And that was the first time that I met Dr. Fauci, Tony Fauci. I had one of his patients who had some serious problems, and I had to call him at like 3 in the morning. I said, "Here's what I'm going to do. I just want to make sure you know this and you agree with it, and any advice you have, I'd be grateful for." And he said, "Yeah, that's a good plan." I implemented the plan and turned around, and there he was. And so he came in and sat with me for about an hour and a half, and we went over this individual patient of his and others that he has on the floor, and he did a lot of teaching, and it was an enjoyable moment of meeting a like-minded soul. We did a lot of work on human B cells. We traveled all over the world to meetings together. It was just a spectacular experience. 1981, at the outbreak of the AIDS epidemic, Bob Gallo calls me, and he said, "I know you've just left the NIH, but I need you to come back." I said, "Dr. Gallo, I can't do that. I've got a robust program here on the human thymus." And he said, "Well, you have to work on this. You don't have a choice. You're the only person that's trained in infectious disease, you're trained in immunology, you've isolated a retrovirus, and you have to do it. This is going to be the greatest pandemic in the history of the world. We have to get on this." So Danny Bolognese and I, who was the head of virology over in the Department of Surgery.
The advancement in the knowledge of this virus and how it causes the disease has been accumulated almost a record pace.
And Danny and I worked together for a long time on trying to make a vaccine. First attempts were initially thought to be successful, but then turned out the whole field was working on the wrong virus. A lot of failures began. I'd been at Duke maybe 2 or 3 weeks, and someone from the Department of Surgery came to me and he said, "Do you want to study the human thymus?" And I said, "Yes, I'd love to." So began 20 years worth of study of the biology of the human thymus. So using tissue from cardiovascular surgery was a great insight that we could use that for transplantation. And I presented this at a meeting, and a young pediatric immunologist named Louise Markert came up afterwards and said, "If you can get that to grow in a mouse, we surely could be able to grow this in my children who are born without a thymus." To our amazement, it worked, and the child's immune system was reconstituted. Louise Market went on to dedicate the rest of her career to curing babies born without a thymus. In 1995, I was asked to become chairman of the Department of Medicine at Duke. At that time, managed care was just coming into healthcare, and we knew that it was going to be a very big job. And so I talked to my wife, Caroline, who at that time was a busy practicing psychiatrist and also had just taken over the advisory dean position in the School of Medicine. We were concerned about being able to raise the children the way we wanted to. Caroline said, absolutely, you should take it, and we'll join together in a partnership, and we will take care of both the children and the jobs. And all during that time, Caroline was just a terrific partner, and we divided up the work and responsibilities, and it went well. One of the things I wanted to work on when I became chair of medicine was the issue of disparities in healthcare, and in particular to work on both racial and gender diversity for both faculty and house staff in the Department of Medicine. And we worked hard on that, and we made some progress over that time. Now, the Vaccine Institute started really as an idea that Danny and I had back in 1990. And we wrote a white paper and circulated it around, and no one really wanted to fund it. And so it basically was just my lab for a long time. And this RFA came out for this gigantic grant to organize all of the southeastern region into an organization to study bioterrorism. Got that grant, and at that time that was one of the largest grants that the NIH had given. It was about $15 million a year. When the CHAVI grant, the Center for HIV/AIDS Vaccine Immunology grant, came out, that grant we went after and won that grant. There was only one awarded. That's when it really took off. It's been a tremendous learning process, but along the way, DHVI grew from 20 people to initially 50 people, and now we're at 300. But we pivoted and took all the technology we developed for HIV and turned it towards working on coronavirus. And we knew then that this was incredibly powerful technology. So we've been working on mRNAs for the HIV vaccine for now almost 8 years. A platform that Kevin Saunders had developed, making little round particles about the size of a virus that had pieces of the HIV envelope on it, and he just took the envelope off and put the pieces of the coronavirus on it. It worked incredibly well. It protected the monkeys, and that was published in Nature as well. And so we're now using that technology for a number of pathogens. But I guess over the past 40 years, I must have had 400 or 500 people working in my laboratory, collaborators all over Duke, a number of colleagues who work with me for many, many years at a time, and contributed greatly to the success of the laboratory and to my own success. Well, that's just the name of the game, is having the opportunity to, and having the resources, and working with brilliant people, and to tease apart the unknown and figure it out. Have that ultimately targeted to help people. It's incredibly gratifying. I have a wonderful family. I couldn't have done anything that I have done without the support of the family, and certainly not done it as well. Caroline, my wife of 41 years, has just been incredibly supportive. When I became chair of medicine, I was the first chair of medicine in many years that had small children. And so I just said that nobody would give me any grief for not being there at 4 and 5 in the afternoon, because I'm going to coach their teams, and I did. I'm so glad I did, because once they all became 14 and 15 years old, they quit talking to us. And so I wouldn't have known who they were if I hadn't sat there with them on the benches and helped with the coaching and all that. The family support has been very, very important for me to be able to do what I've done.
Bart, congratulations on receiving the Lifetime Achievement Award from the Duke Medical Alumni Association. I can attest as well or better than anybody the extraordinary trajectory of your career, which makes you most worthy of this award. From the time you stepped into my lab as a clinical associate decades and decades ago to your most recent spectacular achievements in the field of HIV vaccinology, you certainly deserve this and a lot more. Congratulations.